Hi, my name is Brent McBride. My presentation today is expanding Medicaid to cover non-opioid pain therapies. At 42 years of age, my father died of a heroin overdose. I was 15 years old. It's something I usually don't bring up in conversation, but his story isn't unique, unfortunately. In fact, according to USA Facts in 2022 alone, over 80,000 Americans died from opioid overdoses. Did you know that prescribed opioid medication for pain relief is one of the primary pathways to addiction in America? We're losing lives daily, and many of them are needlessly dying due to an underfunded healthcare system. Medicaid programs need to be expanded through federal funding and mandated at the federal level to cover non-opioid alternative pain management therapies in order to reduce disproportionate risks of opioid addiction among working class Americans who are dependent on Medicaid. This is not some distant policy debate that has no direct bearing on our lives. Many of us in this room will work directly with patients, some of which may already be trapped in cycles of chronic pain and addiction. It is likely that some of you have also lost loved ones to addiction as well. As future healthcare professionals and compassionate citizens, it is our responsibility to advocate for safer, evidence-based alternatives that aim to better serve our fellow citizens. I have spent the last several weeks researching peer-reviewed studies, government data, public health recommendations on this topic, and I'm also someone personally impacted by heroin addiction. This topic isn't just academic for me, it's personal in nature. Today, we'll examine how the opioid crisis is worsened by economic inequality and insufficient Medicaid-covered pain therapies. Then I'll propose a federally mandated solution that includes a comprehensive non-opioid alternatives in all state Medicaid plans. Let's begin by understanding the scope of the problem. The opioid crisis continues to devastate communities throughout the United States. According to USA Facts, in 2022 alone, over 224 opioid deaths occurred per day. But numbers without context do little to convey the story at play here. Who is dying and why are they dying? It's low-income individuals. Those who are most reliant on Medicaid are disproportionately prescribed opioid medications over safer alternatives. According to a 2022 meta-analysis by public health researchers, Atkins and Mujica, published in PubMed Central, individuals from lower socioeconomic backgrounds are more likely to receive opioids because of limited provider time, cost concerns, and lack of covered alternatives. These same individuals also tend to work in physically demanding jobs like warehousing, agriculture, healthcare assistance, fields with some of the highest injury rates in this country. The National Safety Council released data just last year in 2024 that these industries had the highest work-related injuries resulting in the most missed days of work. These injuries frequently lead to chronic pain and are often followed by doctor's visits where the chances of being prescribed opioids is statistically significant for this demographic. Worse, mental health stressors, common in low-income communities like unemployment, unstable housing, and food insecurity, exacerbate addiction risks. In fact, in 2005, Dr. Christopher Hudson, PhD, published an article called "Low Socioeconomic Status is a Risk for Mental Illness," revealed that individuals with lower socioeconomic status are at significantly higher risk of mental illness, which in turn increases the vulnerability to substance misuse, like opioids. This creates a vicious cycle: low socioeconomic status, injuries due to physically demanding jobs, injuries leading to potential opioid prescriptions, and the chance of addiction being further exacerbated by possible mental health issues. Medicaid in its current form is not equipped to interrupt this cycle effectively. But we can change this, we can. Imagine if Medicaid were federally mandated to include non-opioid alternatives, things like physical therapy, acupuncture, cognitive behavioral therapy, massage therapy, yoga as core services for chronic pain management. The Centers for Disease Control published in 2025 a clinician resource called Non-Opioid Therapies for Pain Management. These treatments are proven to be safe, effective, and cost-efficient alternatives to opioids for managing chronic pain. Such a mandate would ensure that all states comply, eliminating the wide disparities in Medicaid offerings from state to state. This mandate would give patients access to evidence-based solutions that don't carry a risk of addiction. Now let that sink in. No risk of addiction. These benefits are clear and measurable. First, offering non-opioid therapies reduces the likelihood of first-time opioid exposure, which is a critical factor in preventing long-term addiction cycle. According to that same CDC publication I mentioned earlier, these therapies not only reduce pain symptoms, but also improve mobility and mental health, two additional factors in healing and addiction prevention. Secondly, expanding non-opioid pain management could actually reduce Medicaid spending over time. According to Lisa, who has a master's in public health, in the Economic Impact of Addiction article she published in 2024, opioid addiction had a national annual cost of $1.5 trillion. $1.5 trillion. The economic toll on opioid addiction is significantly more expensive than preventing it, and chronic opioid users often cycle through ER visits, hospital stays, costly interventions, inundating the healthcare system. Lastly, from a moral standpoint, and arguably the most significant, our working class citizens keep society running and functioning. These hardworking people build our roads, transport our goods, clean our hospitals. When they get hurt, they deserve more than a cheap prescription with potential devastating side effects. They deserve real care, real medicine. Let's take a moment to reflect on what we've covered today. We've discussed how the opioid crisis disproportionately affects low-income working class Americans. We've explored how Medicaid limited coverage of non-opioid therapies leaves many patients without options. We've proposed a federal mandate requiring all state-run Medicaid programs to include these safer, evidence-based treatments. Today, I urge you to use your voice, contact your state and federal representatives, advocate for the expansion of Medicaid to include mandatory coverage of non-opioid pain therapies, support public health organizations working to make this change. If you're entering the healthcare field, bring this awareness with you into every patient visit. My father didn't die because he was weak. He died from an addiction that proved stronger than his resolve to live. We must not cast our vulnerable to the side. We must offer a better path forward. We must have the data. We have the data. We have the proven alternative options. We have the means. What we need now is the will. Let's not wait for another 80,000 deaths to demand change. Let's act now for our communities, our families, and for every patient who deserves better than a pill and a prayer.